welcome to today's Q&A. There are other Q&A sessions that will go on to do with the other tenders that are in place at the moment. There'll be other opportunities for tendering for different pieces of work between now and about January time, really, as part of the work that we're doing that's funded by the National Lottery Community Fund as part of the COVID-19 digital response. I'll just sort of take you through, if I can, a tiny bit about who CAST and Catalyst are, for those who don't know it, and then we'll talk a bit more about the brief. So for those who've not come across CAST before, we're a charity, and we help other charities to create better services for their beneficiaries through those organizations getting a better understanding of digital data and design. We specialize mainly in helping organizations to understand their users and build user-centric services around them. Last year, we started on a mission funded by the lovely organizations at the bottom of the screen called Catalyst to scale up the work that we're doing. And lots of the scaling up of that work is looking for opportunities where organizations can come together and collaborate and be more than the sum of their parts, or can look into reusing each other's solutions, collaborating on solutions, and building shared solutions and finding opportunities for economies of scale. And the Data Collective is obviously part of this sort of initiative. We as an organization have some guiding principles. You can probably understand most of them, so I'm not going to talk you through all of them. But this is basically what guides us, and it's also what guides all the work that we do, and it guides, hopefully, all the organizations that we work with as well. And so by signing up to tender for this particular piece of work, you're signing up to work in the same way as the rest of the Catalyst network. And I'm going to hand over to Rachel, who will nudge me for next slides whenever she needs them.
Thanks, Chris. So for those of you who don't know me, my name is Rachel. I'm consulting with Catalyst to help get this data collective off the ground. Prior to that, I used to be the CEO of 360 Giving, so I have a background in open data standards and working with funders on opening up their grants data. And the reason I was asked to come and do some work with Catalyst was because earlier in the year, in the spring, when the height of the pandemic crisis was happening, lots of funders and lots of charities were asking for data and information on organisation and citizens' changing needs. And it became apparent there were lots of good initiatives out there, but perhaps it was hard sometimes to join that data up. And there weren't always shared approaches to how you might run a survey or capture certain types of data in the same way that would make it easier for other people to access and use this data. So with help from other organisations, I co-wrote a blog that was published in June that was referenced. I think most of you will have seen that. It's on the Catalyst website and was referenced in the blog that linked to this brief. And 15 organisations signed up to that article calling for a data collective. And I think it's fair to say we were blown away by the response we received. Over 30 organisations got in touch with me saying, yes, absolutely, this is something that we need. It's been missing in the sector. How can we help? And those two groups can be broadly, those 30 organisations can broadly be split into two areas. They were organisations that had data that they want to share, or organisations that are working with charities or on producing platforms or resources around COVID-19. And also I had quite a lot of interest from funders who are looking for data and information that they can use to guide their decision making and learning. So I think it's fair to say we felt that there was enough appetite for this idea to try and take it forward. Can we have the next slide, please, Chris? In particular, that call out for Data Collective identified four areas that we want to better understand, which is current and emerging needs and the services that are being delivered to help meet those needs, whether they're working and whether the lockdown has financially impacted how it's financially impacting people and the organisations that serve them. They're fairly fundamental but big questions, and underlying all of them is good quality data that people trust and know where to get it and who's collected it and how recent it is to help answer those questions. But there's no quick fix, I think, to some of this work. And what is increasingly clear is there are lots of efforts to try and answer these questions in different places by different people, and a lot of appetite to try and do that better and collaborate together on how we might do that. So that's what drove the idea initially. Can I have the next slide, please? It was also, I should credit organisations that are already doing some work in this space that have helped inspire it. And for those of you who haven't seen it already, there's MPC's COVID-19 data dashboard that I think they've just made some updates to this week, in fact, that pulls in data from Turn to Us, Buttle Trust and other sources, and is presenting that on a dashboard that DCMS and others have been taking an interest in. And that's an example of, you know, what you can build with a bit of collaboration and some open data and some shared approaches. Other examples of that are in the following slides, please, Chris. There's work by the British Red Cross on developing a vulnerability index linked to COVID-19, and I understand that they are hoping to collect data from different organisations across the UK to develop an early warning system that can help identify changing citizens' needs in the future. And that call out from the British Red Cross for those data sets, of course, it's hard for them to know where they can put that call out. And I hope that things like the Data Collective can help with work like that, you know, help signpost to good efforts and for people to find out where they can get good quality data from, but also ways that they could work together to make it easier to do things like track changing needs and track different approaches to data collection across the UK. And the third and final example is from my my former organisation, 360 Giving, which has developed a COVID-19 grants tracker, and they've worked with those numbers that are increasing every day, so more than 88 funders, to open up funding data specifically focused on COVID-19, supporting charities and individuals during the crisis. So there are lots of complementary efforts taking place in the sector already that we want to support, and that's what has inspired this work. If we can have the next slide. I think that feedback from the organisations that got in touch from the call out was there's some clear areas of work that we could start working on during this pilot phase. That's access to expertise on how you would collect good quality data. I think it's fair to say in the early days, lots of us saw mixed quality surveys and data being produced. And there's definitely an appetite within the sector to try and improve how we would do that. How could we develop some shared taxonomies? How, you know, what does good surveying look like? What are the tools and materials that people can refer to do that? Or speaking to people who can advise you on that at short notice pro bono. We also wanted to look at the option of a community of practice on charity data in particular. I think it was felt that when government was making decisions around what kind of support to give to the charity sector, and when the major membership bodies went to DCMS with a figure, it was quite hard to calculate that figure. And I think there is some work to be done on how we look at the value that charity provides to the sector. The Office of National Statistics has lots of data on the value of business and GDP. It's quite hard to calculate that for the charity sector. And I think there is some work that could be done within the VCS on how we might look at services provided and value delivered. And then there's the really technical stuff, which lots of you will be familiar with, on shared taxonomies and data standards. And there are some projects already starting in that area, particularly classification of charities. The Charity Commission at the moment has a list of 13 classifications that it uses for charities. And I think perhaps something more detailed, I think we're all in agreement that something more detailed would be useful. There is a research project starting on that soon. The researchers working on that are keen to have people who will test that taxonomy, space to share that learning. And And again, on data standards, 360 Giving obviously has a data standard it uses. And I think there are opportunities to perhaps develop other data standards. And there's no one space to go and have those conversations at the moment. And for people just to have a go at using it and piloting this stuff and saying, does it work or not? And if not, why not? And who else could they be speaking with about this? There's also some work looking at how you would collect data on ethnic diversity and inclusion that's been set up by a group of funders. And that initiative is very keen to have charities involved with it. So I think, again, opportunities to act as an interlocutor with the VCS as these projects appear. And then the final area of work, which sounds very obvious, but it's a space for networking and peer learning and signposting to different data projects. So this isn't about trying to scoop up lots of projects and develop some all singing, all dancing platform that's going to solve all our problems. It's about acknowledging different efforts in the sector, pointing to good efforts, learning from them, helping develop shared resources and tools, and helping perhaps put some standards and shared approaches in place where we think there is an opportunity, particularly linked to COVID-19, where the urgency of demand has been highlighted. And there are lots of organisations who would like to benefit from the data that service delivery charities are holding. And perhaps those charities will need some help with sharing that data in an open way so that funders and other decision makers can use it as well. The next slide, please, Chris. So the story so far and how we got to this point. So I started working with Catalyst in April, and I had a lot of conversations in April and May about sharing data on changing needs due to COVID. That led to publishing the blog in June. And that was the response we got to that. I talked about in the early summer from lots of organisations saying, please, we're interested in this. We've got data, or we're running projects. How can we get involved? We've then gone away and looked at how we can support a pilot project. This is going to be funded by the National Lottery under their emergency funding for COVID. So we've got this initial pot of money of up to £48,000 to run a pilot project between now and the end of March. So we've been doing some project planning and outreach for the last month, and we've published the invitation to tender. It's all quite tight timing, but we hope to be able to appoint a project partner in mid-November. So the deadline for applying is the 2nd of November, and we hope to appoint someone a couple of weeks later to start the work as soon as possible, so we can run this pilot between now and the end of March. I hope that helps explain a little bit why this is rather tight timing. It's linked partly to the funding requirements, which are specifically to support organisations working in England with charities working with beneficiaries in England linked to COVID. So we hope that this pilot can happen soon, but longer term, we would also like Catalyst to explore how this work could be taken forward, and if there's a interest in doing that, if indeed there is enough appetite and willingness to collaborate, and then what the resources would need to be put in place for that to happen. And that's part of my role. I hope to work with the successful project partner to help identify what those resources and the next steps might be, and to try and get that in place between now and March. So I would very much see myself as a resource for the project partner to help make that happen. And I'll be working closely with Chris during this time as well. And we are very open to whether this stays within Catalyst or becomes something else, somewhere else. We've got no set view on that at the moment. And I'm very keen that regardless of who the project lead is for this, that there'll be lots of organisations involved. Several of you on the call today, I hope there'll be a way for you to be involved regardless of whether or not you get the contract for the pilot phase. So next slide, please, Chris. So a lot of this is in the brief, but I think it's just worth going through again and making the point that this is very much at this point linked to the impact of COVID-19. So wanting to raise awareness of the different data initiatives relating to the impact of COVID-19. I think it's safe to say there's no shortage of data out there, but it's quite hard to know where to go to get good quality data and the signposting to it, and having to wade through it and get advice on how you can use it. So we're really keen to help make that process easier and put humans at the end of those initiatives that people can speak to. Then there's a community of practice for the voluntary and community sector, where we want ideas, best practice, challenges and collaborations to be shared and explored. At the moment, we think that's a missing gap in the sector, and we want to help create that space and find a way to bring people together across organisations in ways that's truly collaborative, and see what we can join up, which of those efforts are complementary and we can join up. You know, if someone is doing something over in Lincolnshire that's relevant to someone in Somerset, maybe they could think about having a shared taxonomy. If there's something in the youth sector looking at youth services, what's the taxonomy they'd use for that? How could they share that data publicly? What's the license they'd need to do that so others can benefit from it? What's the story they tell around that? And then there's the what I'd consider to be back to basics, which I still think is a key missing area in the sector, which is support and expert advice on collecting, sharing and using data. Still, charities are often quite concerned about data privacy. Is this a GDPR restriction or not? Where can I get advice on that? Data structures that support the sector with responding to COVID-19, really just making a more human-to-human interaction. I think there is a nervousness still in the sector around people who aren't very confident with using data, to put their hands up and say that, and where do they go to get that support and that advice at short notice, with people who know what they're talking about and make themselves available. And then taking that a step further with how can you then bring those initiatives together in ways that allow them to be independent, but also perhaps add a broader value to the sector. And then frankly, also talking about what best practice looks like, so we can perhaps support initiatives that really are demonstrating that best practice. And I would hope to see that we could have some ideas longer term around toolkits and support and tips and tricks that help that, so we can perhaps get a little bit more professional in the sector around how we collect, share and use data. Next slide, please, Chris. So again, a lot of these are in the brief, but just to talk through them. So the desired outcomes, based on the conversations I've had with the 40 and more organisations that have expressed an interest, is how can we develop shared data standards and taxonomies within the sector, increased awareness of the different initiatives and analysis that are taking place, helping see the wood for the trees. There's lots going on. Where can you really get some clear signposting on that? There's the active community of practice that's sharing ideas, knowledge and skills, and engagement with key stakeholders on what data they can use to support their decision making and learning. So we know that government and funders are looking for this information, and at the moment it's not always clear where they'd go to engage with that. And then finally, I'd hope by the end of the pilot, something I could work with the successful partner with is developing a longer term strategy for continuing this work into next year and beyond. So next slide, please, Chris. I think it's worth going through some assumptions that I have made for this project as we develop this brief. The key one is, will charities engage with this idea? There's lots going on at the moment. Charities aren't short of things to do. And I feel confident that we will get lots of interest in this project. It was pretty easy to get 15 organisations to co-sign the initial blog in June and get a resounding response to that. I'm confident we'll get some traction with this, and there's a lot of goodwill in the sector to join up these initiatives in a way that's, I think, based on the Catalyst principles that Chris talked about at the beginning, working in the open, working collaboratively, giving credit to other organisations. This isn't about building a data store. Our plan isn't to build a single data store or a visualization platform, but to bring together people who are doing this well and help support their work and join those important groups and initiatives together in ways that support each other, but also raise the profile of the sector and all the knowledge and skills and experience it has on data with people who help fund and support and make decisions that affect the sector. So we can show that we have this information and help drive the conversation more clearly. And we know there is a demand for data in the sector. And I think frankly, at the moment, we're missing a trick as a sector to signpost better to what we know. And I think the Data Collective can support that. So those are the assumptions that we've made. There is a reference in the brief to wanting a risk register for this work, and I'd be interested to hear what is in the submissions around that, what people think the risks are and how we might mitigate them. Next slide, please, Chris. So the plans for the next 4 months, as I've said, we don't have a huge amount of time for the pilot, so I hope we can get going quite quickly. From Catalyst's end, we will review all the submissions the week after the deadline, and we hope to make a decision on a successful partner the week after that. All submissions will be scored by a panel of 4, including Chris and myself, but also 2 other people that are less close to the project and bring some independence. They're all staff involved with Catalyst. And then we hope to issue a contract and get going ideally by mid or late December at the latest. And the plans are that the key areas of activities would be engaging with data experts and organisations that are currently collecting and sharing data specifically on COVID-19, and looking at how we could join up any complementary efforts and support them, or support specific initiatives or sectors or groups that are looking at collecting data. And as I said, we've already identified a couple of projects that would be worth supporting. There's the one on charity classifications, there's the one on ethnic diversity and inclusion data, and then there's promoting the Data Collective more broadly within the sector and to other key stakeholders. So they see it as an interlocutor with the sector for their work. There's another project that I'm involved with called the Funder Hub that is developing a platform and wants to add data and resources on there. And I'm very keen that the Data Collective is seen as the main contact for that. And again, as I mentioned, there's the British Red Cross Vulnerability Index that's looking for good data sources. And then the other key area of work would be looking for a longer term plan for the collective and the resources needed to run it. And Catalyst is very open to trying to support that longer term plan and get that in place. But crucially, we'd also like to know what isn't working and what some of the biggest challenges are, so we can develop a real roadmap for the future to see if this work should continue. Next slide, please, Chris. So this is something we talk about for all Catalyst projects. I don't know if, Chris, if you want to talk briefly about this. This is actually a requirement of the funding that everything would be published under an open license, but it's also something we support anyway within Catalyst, regardless of the funding requirement.
Yep, I can talk about this. So one thing that we're most happy with, actually, in this, like the discussions that we've had with the lottery about this funding to sort of support individuals affected in different ways by COVID-19, and I should sort of stress that it's not necessarily just people who are infected. It's more the secondary effects which the charity sector is having to pick up, the economic effects, the increase in domestic abuse and things like that. We talked to the lottery quite a lot about the fact that we wanted open outputs for everything in the project and why we did. And they actually have changed some of their rulings around these things in terms of permitting open source licensing and permitting certain types of licenses being used. So it's a bit of an experimental thing, but one that we hope will augur well for massive changes through the funding of the charity sector, so that everything that is produced under a grant, especially when it's using public money, is openly available for others to reuse in different ways. So we currently have 11 charities going through a development program at the moment. They will all work with a digital supplier. They will all make all of the outputs of that available under an open source license. All of the materials from along the way, so anything from discovery through to personas, through to user stories, user research, the materials that anyone is creating to coach them in any way or help them in any way, will all be available under a Creative Commons license as well. And so we think there's a bit of an unprecedented opportunity here to create a corpus of material for charities on how to build better services and on sort of teaching and learning materials on how to work better. We're actually going to be helping the charities understand what it means to work in the open as part of this whole process. And those materials themselves will be open. And so it goes on and on in an amazing sort of meta openness cycle. All of the work that's done here, we would expect, and knowing the people on this call, we don't think that's a big ask for it to be done in the open. So sort of creating week notes, making things openly available as quickly as they can, so that not only for transparency, but so others can become involved in the conversations and can feel shared ownership of it. We think that there is an appetite that has been accelerated by the crisis for organizations to share and reuse. The charity sector has at times not been the best at that. There have been lots of lovely little local groups or special interest groups who are very good at sharing with each other, but they're very hard to find and they're very hard to get involved in. And certainly some of the work that we've done in the early phase around sharing our insights decks, sharing service recipes, and other materials from charities has had a pretty great effect so far. And so we really want to double down on this and make this the default for funding in the future. That's the aim of it. Now, obviously, what that means is that we need to work with partners who are as committed to that as we are. And knowing most of you on this call, I know that that's the mindset of most of you, so I don't necessarily need to preach the converted anymore. But since it is a major sea change from the lottery to allow us to do this, it's something that we want to really push on and make the whole sector understand why we want to do it and how it will benefit them going onwards. So,
Thanks, Chris. Where did we get to in the next slide? So, as you'll all have seen on the brief, any questions we receive for this project are being responded to and then anonymised and added to the brief. So you'll all be able to see all questions that were submitted and the responses that were shared. As of lunchtime today, we've had 5 questions, which you'll all be able to see. If anyone has any questions, further questions linked to those 5, then now is the time to ask. And if you have any more questions, there'll also be time for us to go through that today, and they will be captured and also added to the brief. And you can still keep asking any questions, just submit them to me, and they will be added to the brief up until the deadline for submissions, which is midnight on Monday, the 2nd of November. So everyone will have access to the same levels of information and the responses. So unless there's anything further you wanted to mention, Chris.
Terribly sorry, I ought to correct on that one. I think the deadline for questions is slightly before the deadline for submissions. So we might want to check that one.
Yeah.
So we'll check that and we'll let you all know when the deadline for questions is, because it's normally a bit before the deadline for the brief.
It's probably in the brief.
Sorry to correct you there, Rachel.
It's fine. Having created that confusion, should we go to some Q&A? Anything else, Chris?
That sounds good. I'm going to stop sharing if that's okay, so I can see everyone's lovely faces.
So I haven't been able to keep up with the chat, so I suspect that's lots of people agreeing that we need to sort this issue out. Are there any specific questions that people have at this point?
So there is one that says, what role do you anticipate the members of the data collective playing in the project? So I think that's people outside of the suppliers.
Yeah, that's a great question. I see the collective as being greater than the sum of its parts. So I hope that by bringing organisations and individuals together that care about the sector and care about good quality data and serving the needs of organisations and communities, being able to come together to develop better quality approaches to how we collect, share and use data within the sector. So it would be a support network, a peer network, but I also see them as being able to come and say, I've got this issue or I've got this idea, and being able to go to a like-minded community of people to get support with that. But it's not a place necessarily where we would say, oh yes, we're going to support that and here's some money and it's something that will help you run. It's not that kind of a financial program, not what I envisage at the moment. I mean, I'd be interested to hear if other people think at the end of the pilot that that's something it could become. But at the moment, for me, it's more about signposting to good initiatives and exploring ways that they could support each other with more shared approaches or better awareness raising of all the work that's going on out there. Well, I mean, a fundamental issue that I still see within the sector is people aren't aware enough of all the different initiatives that are going on, and there isn't always enough expertise within organisations on understanding what good quality data collection looks like. I think that's still, I know that sounds quite basic, but I think that's still something that really, shared data standards and taxonomies is the lack of that is a fundamental issue within the sector still. And I think that's been highlighted by COVID-19. And I think there are still some quick wins that could happen linked to COVID-19 data that the collective could help with.
Perfect. There's one that I can answer now. So a timeline question, does the work complete beginning or end of March? Ideally, we would like it to complete at the beginning of March. However, we realise that time is very, very tight there. We are currently talking to the lottery about whether some projects can complete at the end of March. At the moment, everything has to be reported on to them by the end of March, but they're very aware that the timeline is incredibly tight. And so depending on when the project starts, we could chat to them to see if they'll let us complete a tiny bit later on in March on that one. But I think the majority of the work needs to be completed by then, and any information that's required in reporting needs to be in by then as well. And I can give you a quick update on the questions. So the questions need to be in by the 26th of October, which I believe is Monday at midnight.
I just corrected that on the slides.
Brilliant. So on to another question. So this is one for you, I think, Rachel. So can you say more about your vision for the work post-March and its sustainability?
Yeah, so as I've said, we've got up to £48,000 to allocate to this pilot. And then after that, new funding would need to be sought if there was enough interest in the, enough value, people thought there's enough value in the collective continuing and enough interest in that happening. And I would be happy and expecting to help support the project partner with thinking through that work post-March and the resources needed for that. And I'm already quite confident, based on conversations I've had with some funders, that there would be a lot of interest and appetite in this. I think what's less clear at this stage is what that would look like, where it should sit, what resources are needed, and a roadmap and a work plan to go with that. But I'm very much expecting to support that work and help make that happen. But I don't at this point have set views on what that should be. I think that would be unhelpful. I think the pilot needs to happen first, and we need to get that learning and see what happens and what appetite and engagement there is before coming in and saying, well, this is what it should look like. Otherwise, it's being shaped too much on the theoretical, and I would like us to have more practical experience before we start preempting next steps.
Yeah, and I think that speaks to the comment that you've made, Ed. It does take a long time for these things to happen. But we see this really as being at the discovery stroke alpha phase at the moment. We want to understand if there is an intervention that can be played here. We believe there is. We think there's some evidence from a few things that we've seen that there is the opportunity for an intervention, but we're not sure yet. And so this isn't saying, right, we'll make a data collective and feel everything's done and dusted in March. It's more to understand if our initial reckons about what sort of interventions are needed are correct or not. And all of us have been involved in projects many a time, and we'll know that some of our reckons are right and some of them are wrong. And that's really what we're trying to sort of find out through this sort of piece of work. It's around what are the user needs within the sector around data, and not just sort of directly in the sector, but sort of from allied elements of it, such as government or funders and things like that. And how do we understand how best to serve those needs, and what interventions work and which ones don't.
Yes, I'm not, just to add to that, I'm open to the idea of this, perhaps this collective also doing some advocacy work. I think there's an opportunity perhaps to talk about the data that's collected by the regulator and how that could be more usable as well. And I think if there's an appetite for the collective to become quite technical or do more advocacy or be more of a support network or a combination of those three things, I think we're very open to that. I think there's something around bringing expertise together, of which there is lots in the sector, but it's disparate and spread out. Providing a space to show that collective expertise and act as a point of contact, I think would in itself be a huge success.
I think because of the time constraints, I think we'll sort of rattle on to the next question. I think this one's again for you, Rachel, and I'll take the following one. So, do you see this as a location for a community to convene, or a set of materials to increase effective data sharing, or both?
That's a great question, Elliot. I think both, actually. I think there's something about the community to convene, but I think there's also something about what does good look like and who's doing good work and what can we learn from that and how can we collaborate better and what materials do we need to help us do that. And longer term, resources, toolkits, pointers, access to just people, experts to speak to. So I think it could be a combination of both. I'm very aware that creating a talking shop at the moment is perhaps not, I think there's lots of conversations going on. There needs to be some actions and some particular projects and things to focus on linked to COVID. Does that link to the next question partly, Chris, as well?
Yeah, I can take the next one. I think also to follow on from that, we found in the early phase of the response, some of the simplest responses were the most effective ones. Sort of things like recipes have been incredibly useful for charities trying to understand how to stand up services super quickly. And then it's not a complex format at all. It's really just understanding what the need is and what steps to reproduce something. And one of the discussions we've already had is, well, are there data equivalents to recipes for sort of standard, sort of things that are done? In terms of the next question, it's not poorly worded at all. I think, the lottery funding is for COVID response. It's been quite obvious sitting in the position that we sit within the charity sector, sort of helping organizations to create better digital services, that for the first 6 months, pretty much every charity has in some way, shape or form been involved in responding to COVID. If you're an education charity, you're suddenly, sort of helping schools and parents and kids learn at home. If you're a charity who looks after mental health, suddenly you're doing things differently and digitally as a result of COVID. There really isn't much of the charity sector that hasn't been affected by it. And I think, without being political about it, that's going to go on for the rest of the year at least, probably into next year and beyond, as we start seeing the sort of like the aftershocks of what's happened to society, economically, health-wise, mental health-wise, etc. And so, we've seen everyone from domestic abuse survivorship charities through to, some of the most, you would imagine them to be sort of like the most middle class, sort of least affected charities, be quite fundamentally changed by this. And so I think whilst we are in the sort of like the letter of what the community fund has said to us, we have to respond to COVID. The whole sector is responding to COVID pretty much every day in different ways, shapes or forms. And, you know, sort of, so after COVID, this will still be needed. Before COVID, it was needed, but charities probably weren't ready to engage with it quite so much because their ways of working hadn't changed quite so fundamentally. But I think it'll be needed even more. I think one thing that we have really seen is it's very hard sometimes to get the right sort of data into the right sort of place at the right sort of time in the right sort of format. And that's for all sorts of reasons, like, you know, the ridiculousness about not having the correct geographical underlying data layers, through to organizations not knowing how to publish data openly, through to organizations publishing data in their own weird and wonderful formats and schemas rather than picking the open ones that are out there and being ready to use all the time. So I think, you know, sort of this piece of work is needed now because we're still in the response, and we will still be in the response until spring next year. It's, you know, things are going to kick off again this year, and we will need to respond to changing needs, expectations and behaviors of the charities who are dealing with the changing needs and expectations of their service users all the time. So I think it's this piece of work would be needed without COVID, but it's accelerated massively through COVID. And the COVIDness of the response is wide and multivarious, and sometimes you can't even see where it originates from. Does that answer your question, Tom?
Yeah, it does. Sorry, I've come off mute. I'm flouting the rules. Hello, everyone. I'm Tom. For those that don't know me, yeah, I guess it was really just to, I suppose I could just see a place where what people would say in kind of the initial stages might be different if you framed it in a COVID-19 sense as opposed to just a broader data sense. So it was just really just to sound that out and see what the restrictions were from the funding side of things.
Yeah, no, good to clarify that. I mean, it is wide. It is as wide as the charity sector is wide, because all bits of it are picking up the pieces in society where society has been fundamentally changed by this.
I think, does that link to Julian's question? Does the pilot aim to be geographically spread or focus on verticals within the VCSE? It
does. Shall I take that one?
Yeah.
This one's a slightly odd one to be discussing. So the funding is specifically for English charities. That's a condition from the lottery. It may well relate to the strange sort of balkanization of the VCSE sector in different ways in devolved regions, but it is for English charities primarily. However, I think that's not to say that it will be gated for only English charities or English organizations to use the data there. We just have to focus a tiny bit on that because of the conditions of the lottery. So, you know, to give a real life example, we have a beta of recipes coming up. We can only really take recipes from English charities because they're the ones that the funding relates to. However, anyone across the country can use those recipes, and we're actually working with the Scottish Council for Voluntary Organisation to collect recipes from Scottish charities. I wish it wasn't this way. It's just how the funding is for this particular period of time. However, I think the data collective is very much for all charities throughout England and Wales and Scotland and Northern Ireland, but we just have to, because of the nature of the funding, prioritize England. But the outputs and the sort of like the positive results from this will spread far and wide across the UK. I think there's one for you here, Rachel. Can you give an example of the type of people who you think would find this most useful? What jobs do they currently have?
Sure. So as it's mentioned in the brief about the users and what they need to do, we've said the key audience for this work is VCS organisations, and within that I see it as decision makers within VCS organisations, but that they wouldn't necessarily be the people who directly engage with the collective. I imagine it would be data analysts, researchers and policymakers within VCS organisations. But we know there is an appetite more broadly amongst data analysts who want to understand what data sets are available about the voluntary and community sector. So they could be people in the private sector, government, research. For quite a lot of academics get in touch. Funders, I've already mentioned, are very interested in this data. And Catalyst partners themselves, who Catalyst is as part of this lottery funding focusing on 9 thematic areas, and we also want to understand work going on in those different thematic areas. So those are the users we've identified, but in terms of specific job titles, I imagine it would be data analysts and researchers who are used to having these conversations around data structure, taxonomies, and sharing good quality information.
Lovely. I'll take the next one. So looking at the outcomes described in the brief and listening to the discussion, it feels like we're in discovery. However, several outcomes seem more pilot than discovery. I think what we hope to do is an accelerated discovery in alpha, if I'm honest. There'll be some prototyping with data. There'll be some prototyping of some things that we think need to be, and then we'll be testing the response to those. I think we still have some discovery work to be done, and I think we need to do more of that around what the needs are. But I think we've got a good idea of some of the needs already. And so in a way, what we'd probably like to do is sort of show the people who have those needs some of the things and see if any of them stick. So I think, you know, sort of, and this is partly because, you know, we are constantly responding to a crisis at the moment. You know, we don't necessarily have the luxury to do much longer discoveries and much longer alphas at the moment. It might seem like we're not sometimes, but I can certainly tell you from being inside Catalyst, it still feels like we're in that response mode a lot of the time. And we want to actually get to the thing a tiny bit quicker some of the times, just to test it out in front of a live audience and see if that's the thing.
I think it's fair to say that both Chris and I would have loved it if we could have started this work at end of July, early August.
Yeah.
After, you know, we got great feedback from that June blog, lots of people crying out and saying, how can we get involved? And we said, hold on, we just got to go and get some money, and then we've got to procure it, and then we'll start the work in November. So we're starting a bit later than we'd hope, but we are where we are. But as I mentioned earlier, there are already 4 initiatives that I've identified that I think we can make some progress on between now and March, and that's the charity classifications research that's happening. We want people to pilot that classification once it's ready and provide a place for those 2 researchers to engage with the sector. There's the Funder Hub initiative that's looking for data sources across the sector to help guide funders' decision making and learning. There's a civil society review that Pro Bono Economics, one of the co-signatories to the original blog, is leading. And one of the things they want to look at is whether the Office of National Statistics should start measuring the value of the charity sector in the same way that it values and measures GDP and the contribution that business makes to society. And then the 4th initiative is work within Catalyst itself, where we want to explore what shared taxonomies we can use on different thematic sectors. And there is a live project being led by 360 Giving with 14 funders looking at ethnic diversity and inclusion data. So there are some specific areas of work where I think we could make some progress.
I think also to add to that, there's we know that the youth sector are building their own taxonomies and they're actually doing it really, really well. So that's something that can be supported there. Amongst other bits of Catalyst, we're looking at how we describe shared needs and we understand shared needs. To the 100 and something, I can't quite remember, it was a lot to read, applications for the development funding, a quarter of them were around e-learning. And so clearly there's sort of some similarity in how you deliver e-learning and things like that. So we're looking all the time for where there are opportunities for shared infrastructure, not necessarily, you know, infrastructure with a large I, but sort of more sort of shared solutions and shared ways of doing things and describing things. The other two sort of macro things to sort of put this work into context is there's a national data strategy going on at the moment, and there's also Danny Kruger's report around the voluntary sector that we need to sort of think about how this sort of initiative fits in with and responds to that sort of thing. So I think there's a lot of effort and a lot of moving parts and initiatives to sort of try and draw strands together here, and to understand how to disseminate information as well.
And what we're lacking is consistency of message, and we hope that this collaborative could be a place where, you know, if for example, we have been feeding to the National Data Strategy as Catalyst, we've also been to the Danny Kruger report. What is the consistent message that we want to be saying, and what's the data that we use to refer to that, and how do we check that that's appropriate, and how do we tell people we're doing that and join forces with others? So I think there's just an opportunity there to tie some of those threads together. Julian, you've asked a question about the role for local authority VCS people being involved in this. Can you just clarify what you mean by local authority VCS? Sorry.
Yeah, because at the moment we're working with working with local authority and also a number of VCS organisations in the delivery of services regarding COVID, and so there's a very close relationship, and obviously that's becoming more datafied. And so obviously the LA obviously has a big part to play in that role. And I was just, are we mindful and cognizant of that, or are we just avoiding that?
I can take that one. I've spent the last year getting bits of the charity sector to talk to bits of local authority around things like open referral and all sorts of other sort of data sharing opportunities and places where there is currently friction in that interface. You know, we know, and you know that, but I'll say it for the others on the call who may not know, that £1 in £8 of local authority spend is with a charity or voluntary sector organisation. And so it's a considerable interface in terms of both money and sort of like the overlap and there's just sort of like the surface area of the interface. And so it's something we are very interested in. We're also very interested in what local umbrella or infrastructure organizations within the charity sector can do to help the smaller charities in that interface with the local authority. So we are part of the latest MHCLG bid stroke support for open community and open referral. And I think we'll constantly look for places where we can help out with this sort of smoothing of the surface, really. You know, these are just people in need. It doesn't necessarily matter who supports them, whether it's local authority or whether it's charity. We just need to make sure that everyone knows that they're being supported so that less of them fall through the cracks.
I think, as you'd expect us to say, Julian, the answer is yes, this is a big tent initiative, and why wouldn't we want to engage with anyone that was interested? I think there are also some nice, in addition to the work taking place in Manchester and the charter that has been developed up there, led by Open Data Manchester and you, there is also the work taking place in London, the London Office for Technology and something, Lottie.
Innovation.
It'll be I for innovation, it always is. They're also doing quite a lot of work with different London boroughs, looking at what data they collect, and again, you know, the thorny issue of shared taxonomies. So I think there are things that we'd want to hitch our boat to, as it were. I think, particularly given, you know, Chris's point about the role of local authorities and charities in helping deliver services.
Yeah, and we've been, since the very early days of the crisis, we've been part of the GLA Data Bytes group. We've, you know, along with Giselle and others, we've, you know, we spent quite a lot of time working with London funders who are looking at sort of individual charity needs within London, but have also worked with people like Small Charities Coalition, who work with the smaller organisations that are doing stuff on the ground and who maybe don't necessarily have that connection to local authorities apart from in terms of a referral. So I think one of the things that we've got to try and do through this is to join up all of these pieces and find ways of making easier that joining up. I think at the moment it feels very frictionful in terms of who's doing something and where's the data about it, and that I think is sort of in a way the main thrust of what we'd like to fix with this.
We are at time. Are there any more questions? Or is there anything that remains unclear to anyone at this point? I'll just go perhaps whiz through the timelines again at the end, where everyone's clear.
So there's a very good question from Elliot. Is the consistency of message problem within the scope of this pilot or just a piece of context?
Oh, Elliot, that's a good question. I think it's probably just a piece of context because this is a pilot and it would be unrealistic to say, let's get a consistent message by the end of March. In my rich fantasy life, it would be something we'd fix by March, but I think Chris might tell me. I'm trying
Dreams in reality.
Yeah, it's context, but it would be a longer term aim would be, where is the centre of expertise on data in the VCS? It should be within the VCS. At the moment, to me, sometimes it feels like other people make those decisions and have that data on our behalf. And I think we could control that messaging in a more collaborative way. Obviously, this isn't about control and power so much, but more about all the work that charities are doing, all the services they're providing, all the needs they're seeing, all the learning they've got, sharing that across the sector, but also to others that make decisions and fund the sector in a more consistent way. For me, I think that's the real opportunity of the collective longer term.
I think it's definitely something to aim towards. I think, that is the work to a certain extent.
In a gold mine of data. Let's get it. That would be mine.
Yeah, I think getting it done by March might be tricky.
Not quite a question, but if I could share a concern, I mean, the brief is really exciting, and it was great to be on the call. The one thing that's making me a little concerned is that quite a few of the use cases we've touched on seem to be about making the sector and the people it supports legible back to the funding and policy community, like sort of quite a technocratic bent. Now, I don't imagine that's what you've got in mind, because I don't know you personally, but sort of I know quite a few of the people involved in the initiative, and I don't think that's their take on the world. But I just wonder if you could speak to that.
Sorry, Tom. What do you mean? What do you mean specifically in terms of technocratic?
So I suppose the question quite often with data projects is not who is the beneficiary per se, but who is the user? Are we trying to make sort of a complex, messy world legible, the messy world that service delivery charities work in, legible to funders and policymakers, in which case funders and policymakers are the users, we're trying to make it easier for them to do their jobs? Or is the person who is actually going to be sort of directly getting sort of benefit from the service, the person who works in a service delivery charity? And quite a few, now parts of what we've talked about, the idea of sort of creating a collective, you think, well, actually, I don't have to prejudge what is going to be useful. I'm putting together a collective, and I'm pretty sure that if I invite the right people and set up the right environment, they will come up with things that are useful to them. And, that doesn't take you in a technocratic direction. But quite a few of the existing ideas for use cases that we've talked about sound as if they're actually about making the sector and its beneficiaries legible to sort of bodies at the centre, like funders, like the policy world.
I can give a quick answer to a bit of that to give my view, and then I'm sure Rachel will as well. I don't think it's that. I think is my response. There are lots of things that we are doing as part of Catalyst, which will have an impact on funders, but it's not necessarily that they're the primary impact. So I'll give you a really good real world example around recipes and service patterns. So we're doing that piece of work so that charities can pick up the work that others have done more easily and build better services. That's the reason for it existing. The byproduct of that is that the funders will start to have an idea about what sort of solutions are available within the charity sector already to respond to a particular problem. And they may well in the future be able to turn around to the charities who apply and say, well, actually don't necessarily create your own thing to do that. If it works for your users, then why not reuse this thing or remix it or whatever? And so I think in the same way that recipes has a byproduct that helps funders or changes the behaviors of funders, I think the data collective potentially does the same sort of thing. So funders will tell you that the sector is messy and they're not quite sure of the value contained within it, or all sorts of different ways of describing that sort of thing. And they're probably right. And we know from the discussion with Treasury about sort of what's the economic value of the charity sector, that there's a disconnect between what it does for a user and what it does for society and what people believe its value is. And so I think a byproduct of this work would be that things are more readable. But as far as I'm concerned, the end users for this piece of work are delivery charities. That's who it's for. It's for making better services. All that we do at Catalyst and CAST is about making better decisions, about making better services and understanding users better, and having collective intelligence that can be brought to bear in service design and service delivery. But Rachel, I'm sure you've got thoughts as well.
I agree with that, and I suspect, Tom, part of the reason you've got that impression is because the examples I gave, because my background has been working with, up until very recently, been working with funders. But actually, the example that I think I really want to emphasise is the British Red Cross Vulnerability Index, where they've put a call out because they want data from across the UK to help them include in this index useful data sets on changing needs in citizens in different places. And one of the things they come up against is that it's hard for them to find. There's lots of data out there, but good data sets they can use and how they can match that together. And where is the place where you could go to have that conversation? So those different organisations providing those services can share their data in ways that others can benefit from it too, but also they can understand changes in service needs and changing demand of citizens. I think sometimes we hear a lot about also what charities are doing and not always enough about the needs of individuals. And I know there is lots of data out there on the needs of individuals. Citizens Advice Bureau talked about this with me when they first signed up to the blog. They've got lots of live data on what, they get calls on every week from people. They've got, that's live needs data. How could they share that with others, and who would they go and speak to about that, so that others could benefit from that data set in a way that's appropriate? What's the privacy restriction around that? Ditto Samaritans have talked about this as well. It's around bringing those organisations together so that others can benefit from their data and understand their services too. But there is a trickle-up effect. I mean, there is definitely demand. I think we have to acknowledge that the organisations that fund the sector, they should be using this data as well, and we should be confident in what they're receiving and using and helping drive that, I think, more.
I can give you a live case from the sort of like the first phase of the response. In the Insights team, we were very, very painfully aware of the overrepresentation of BAME individuals in deaths. We saw it every day. It was really painful to look at the news and try to work out how we could help. And there simply wasn't the data that we could join up around government data to charity data to funding data, so that we could tell the funders that they were putting their money in the wrong place. And as a result, the service users were less supported. And so whilst I agree with you around the risks of sort of the technocratic layer of the funders, actually the funders would love to be better connected to understanding service user need, rather than that being through the lens of charities. And the sort of like it was really difficult in that first phase of response to feel completely impotent to solve that problem, just because the data didn't join up and we couldn't work out how to do it and how to get the funders to understand, or the funders to have the confidence to understand where they should be putting their money.
And what's come out of that is now 14 funders have got together to try and develop a shared taxonomy on how they collect ethnic diversity and inclusion data. And they've asked 360 Giving to help them with that because they know about shared taxonomies. And 360 Giving, quite rightly, have said, well, hold on, you need to bring charities into this conversation, because it can't just be controlled by funders, and charities have this experience and background of working with these communities, and how you go about collecting this data and who asks that question and how you store it are all important political questions. And there's an opportunity, I think, for the collective to work with that initiative to help bring the charity voice into that conversation. At the moment, there is no charity representation in that initiative. So I think there's something important about bringing both sides together that care about the sector and making sure that charities' experience and voice is heard in those conversations. That's a very long answer, Tom.
Yes. But I think coming back to your first your question, you know, who's the primary user, who's the secondary user? Well, the primary user is service delivery charities. You know, because actually in the early phases of the crisis, there were organisations who wanted to understand where the greatest need was, so that they could go and help with that. And in some cases we could help them and we could find it and see it. And in other cases, the data just didn't join up because of, you know, different data formats, different identifiers, the usual problems that you get whenever you've got any large scale data sets.
And then on that, I mean, I'm keeping out there. No, I don't think anyone else asked a question in the chat. Otherwise, I'd shut up. I promise. But the other, if we're talking about needs, it's interesting. At what point, and maybe this sort of pertains back to Julian's question in some senses. At what point do we talk about local authorities? Well, I mean, I suppose the public sector generally, local authorities just has to be the one on the top of my mind, and the VCS being able to share data on needs. I just think some work I did last year, you know, we were looking at the way that you could sort of reuse the data that children's services sit on, basically on all the incoming referrals they have, to build a picture of how needs are changing in a given geography. I mean, they get 600, 700,000 referrals a year they get more, they get 600, 700,000 that they assess in quite a lot of detail. You know, that kind of thing feels like something that would be really usefully added to some of these conversations.
Yeah, and I think there's an open door to be pushed at both in the charity sector and the local authorities sector on that. And, you know, we're sort of looking at opportunities for that and places where, you know, that has worked really well around the world. You know, there's a fantastic example of that in Australia, where there's an app called Ask Izzy, which is basically built on a huge amount of data, because all of the homelessness charities use pretty much the same casework system. And as a result of that, they're able to predict areas in Australia where they're not going to have enough shelter beds. And the local authorities there are able to go and sort of work with the charity sector to sort of start building that. That's incredibly sophisticated. And we're nowhere near that in the UK because of the sort of massive balkanization of data and standards and systems. But it's something we're super interested in.
And I think this is where that youth sector project that Chris mentioned earlier could potentially be a door opener. There's an appetite within the youth sector to develop some shared taxonomies on youth services that are being provided. And I think that's where local authorities could also get involved in that. And the role of the collective would be to help those organisations in the youth sector that want to do that work, advise them on how to go about doing that, how they would approach it, pilot it, thinking about all the different uses of the data, local authorities being, you know, one of the key users of that potentially. But not to take it and own it and run it on their behalf, but to help them do that and get access to expertise that they might not have within the sector already, but they know what services they provide and what they need to capture. We are running over time. Is there anything else, any other questions? As I said, you can keep submitting questions until Monday. Great. Well, thank you everyone for joining us. I'm really excited to be part of this project, and I hope we'll get some great proposals. And as I said, it'll be reviewed quickly and a decision made within 2 weeks, hopefully the deadline. So we hope to get going mid to late November. But please do contact me if you have any further questions, and we'll add them to the brief by the end of Monday. This recording will be made public within the next 24 hours, and we'll capture some of these questions and add them to the brief as well.
And I'd just like to say this was a really exciting conversation. You know, it went in all sorts of fabulous places that show me why this piece of work needs to be done and why it needs to be longer than just the sort of like the bit that we've got the money for. But that hopefully this can just be a first step, and that, you know, these conversations can keep on until we've solved this problem.
I'm very keen to make that happen.
Lovely. Thank you all. Thank you so much for coming. Rachel and I will sort of stay on because we've got to do a bit of closing down of things and saving things, but thank you.